you too. All right, sis, make that appointment, okay?
Yes.
Thank you.
Yes, yes. How are you?
How are you?
Oh, anxious.
Well, the tests, the x-ray and the test of your bones were all good.
Oh, thank God. All good, huh?
Yep,
Thank
all
God.
good. So now I'm going to talk to you about the treatment that you need.
Mm-hmm.
First, I'm going to
All good.
start the treatment as soon as we get approval from your insurance company,
Okay.
because the insurance company has to pay for the drugs.
Okay.
The drugs, unhappily, are going to cause you to lose your hair,
Okay.
maybe your eyebrows, even your eyelashes,
Okay.
but they all come back.
Mm-hmm.
And they all come back within a few months. I will get some laboratory information today. They'll take some blood, and then we can use that to calculate the dose of your drugs, and you could start the treatment. I think if your insurance company is good, I don't know what kind of insurance you got, we'll find out. You could start next Thursday.
Okay.
Today is Thursday, so a week from today.
Okay. When you say the dosage.
You gotta talk louder.
Okay. So the results came back all good. So that means good meaning what? What does good mean?
That means you don't have any evidence that I can see of tumor anywhere.
Tumors.
Not in your bones, not in your lungs, not in your liver, not in the places where a tumor can wind up if it spreads. But I don't see any evidence of spread.
Okay. No evidence.
Now, that doesn't mean that there couldn't be one cell someplace, because we can't see one cell. We can only see things that are about that big. So the reason you get chemotherapy is because, by and large, breast tumors have a tendency to spread in the body. The breast is gone, that's not a problem. But the body is a problem, and we want to make sure we kill as many of those cells if there are any there. And we don't know for 100% certain that they are there, but nonetheless, that's a possibility. So we want to give you chemotherapy.
And then you said dosage. What is dosing? Or do they base it on how much, what they saw, what they didn't see in terms of dosage? How do they determine the dosage?
No, and the dose is primarily determined by your body size and the chemistries that I see when we take some chemistries today, because we'll measure the functions of your liver and of your kidneys and of the bone marrow. And so we'll then decide, because if your kidneys weren't functioning well, which they ought to be, but if they weren't functioning well, then we have to change the dose some, because you would accumulate it in your body, that kind of thing.
Right, okay.
What kind of insurance do you have?
Empire, Blue Cross, Blue Shield?
Shouldn't be any problem.
Okay.
They would hardly handle it. However, when I went back to look at all the information after your visit last time, you told me a lot of what I thought represented Memorial Sloan Kettering Cancer Center, but it didn't. You were done at NYU.
Right, it started at NYU. My coverage changed, and then I went to Sloan Kettering.
You did go to Sloan Kettering?
Yes. But they did the cutting, but they did nothing else. They just, they saw what they saw from NYU, and they just continued.
Okay. So because the reports come from NYU.
NYU, right.
But they did the cutting at Memorial? Amazing. And was the NYU in Manhattan or in Brooklyn?
It was in Manhattan.
It was
It was in Manhattan.
down on 26th Street
yeah.
here?
Yeah.
I'm surprised there's essentially no information from Memorial Sloan Kettering. Most of it is from
NYU.
yeah.
Isn't that something?
Look, all of that comes from NYU.
Wow.
All of that information is from NYU.
Wow.
None of it. NYU, Langone, all the way. None of it's from Memorial Sloan Kettering.
What? So that means that they pretty much just continued information from there without really looking.
A little louder.
So that means that they really just continued information without really checking themselves and just kind of.
I don't know. I'm surprised. I would have expected. Let me be sure I didn't make a mistake. But everything there is still NYU, Langone. Every single entry. There's not an entry there from Memorial Sloan Kettering. And yet I've seen the surgical information, and I'm surprised if the surgical work was done at Memorial Sloan Kettering. But where's the operative report from Memorial Sloan Kettering? You know, everything here is from NYU.
The operative report?
Well, I would have expected it, but I've seen.
What's an operative report mean?
Well, the surgeon, after he does the operation, writes a description of what he did and what he found. You know, that's the operative report. So that, you know, if he says, I cut this blood vessel, or I cut that blood vessel, or I did this, or I did that, that kind of stuff is described for every patient who has an operation. And you just...
Is that different from the pathology report?
Yeah.
Wow.
Pathology report is after the pathologist in a different laboratory somewhere reads, looks at the slides and makes a report of what they found. But the surgeon has to write a report of what he did. You know, suppose we were talking about an amputated leg. He doesn't mention that the leg is gone. You have to wonder, how is the patient going to walk? And so on, that kind of stuff. So, and there's a lot of plastic repair. You had bilateral implants. So, was that was done at the same time at Memorial Sloan Kettering?
Yes. Yes.
So, and you don't have any papers that you didn't bring that that's the place where ordinarily the report would be for Memorial Sloan Kettering. Nothing.
And
so do you have any?
no, they didn't give me
stuff at home?
anything.
Huh?
No, they didn't. All I had was a pathology report.
You don't have any papers
No.
at home that you didn't send?
No. That's what bothered me, that everything was done in NYU, and then they just really just having, I guess, that information, not really kind of doing their own research or understanding what was going on, and just.
Why did you go to? Who sent you to Memorial Sloan?
Well, I went to Memorial Sloan because I was there 10 years ago, and when I
For what?
A tumor in my colon, a carcinoid. So I was there 10 years ago for that. And so when my insurance changed, I just said, let me go back there.
Let me see, because I don't recall having seen all the information about the
Even when I did,
colon, but I do remember there was such a thing, and now I want to find out whether or not we have any information that relates to it.
that was when that occurred. I had actually the workup was done in Brooklyn, and then I ended up with a doctor because I was doing so much running around looking for a doctor because this didn't work out. It was really just a strange experience. I ended up in Manhattan, and when I was in Manhattan, she knew someone at Sloan Kettering. But by the time I got to Sloan Kettering, they were just only able to identify where the removal was. Well, it wasn't a polyp; it was a carcinoid. They were able to go back in and look for where the initial removal of that was and tattoo the area, and then gave me a diagnosis of 5. Come back in 5 years, well 3 years, because it was a rare type of tumor. So they didn't really
That was about 10 years ago.
Yeah, that was 38. They didn't really do any workup over there. They just to kind of follow up. And when would they check again for to see if the chemo? How often would I come for a checkup? How often would I come for a checkup to see if the cancer is completely gone?
After the treatment, the first year you come every 3 months. The next year you come every 4 months, and then after that every 6 months.
Okay.
And any time that you think something's going wrong.
Okay.
Reality says I'm not going to be here for many years. I'm already a very old man.
Mm-hmm.
But if in fact we finish with this treatment, and I think you're the last new patient I'm going to take.
Mm-hmm. Thank you for accepting me. Thank you.
Of course. I don't want you to come in to get sick. That's my job, is to keep you from getting sick. And if I can do that, then eventually I'll be to somebody else to follow when you're in good shape. I'm looking now to get all the pathology, just because we don't have, and I just did one for pathology, and it came up with medications, not really. And this is